Hi, I'm Dr. Roger Cohen. I'm here today to talk about EMDR music and anxiety disorders. And I just want to look at today some of the benefits of using EMDR and EMDR music just from an academic standpoint uh, for, um, for the treatment of anxiety disorders. So this is where we're going today. We'll start with the basics. We'll define it. We'll look at what EMDR music does. We're going to look at the global burden of anxiety disorders. We're going to go into a little bit of a deep dive theory. We'll look at five clinical populations with PTSD, GAD, social anxiety, panic disorder, and some phobias. And then at the end, we'll wrap it up. So I like to start with a little bit of a background discussion. And so the before we can evaluate really how therapy and clinical applications of EMDR music works, we need to be understand where it comes from. So when we talk about EMDR, we're talking about the eye movement desensitization, reprocessing structure of hypnotherapy, meaning it is a defined protocol or a theoretical model. And it's evidence-based that uses bilateral stimulation to help patients reprocess distressing memories. It was developed by a doctor called Francine Shapiro in '89. It's quite interesting. She noticed that moving her eyes from side to side while thinking about a stressful memory seemed to reduce its emotional impact. And she then designed controlled experiments around that observation, and the result was the foundation of what we call today EMDR therapy. It's not a fringe therapy. It's endorsed by WHO, the APA, the VA, Department of Defense. It's the first line treatment for PTSD. And the core mechanism is called something called stimulation. And so that's alternating sensory input to both hemispheres of the brain. The original delivery was visual, a therapist moving their finger back and forth while the patient tracks it. But bilateral stimulation also can be delivered tactily through alternating taps, auditory, through alternating tones, or through stereo headphones. So, what is the music and what is therapy? So, as we started to define it, what EMDR therapy is, then we'll shift into now what is EMDR music. So, EMDR music is the intersection of bilateral auditory stimulation and therapeutic musical composition. It's not just ambient music, it's not just white noise. It is audio that has been specifically engineered to deliver bilateral stimulation while also leveraging the therapeutic properties of music itself. So here's what that means technically. The audio alternates from left to right in your headphones. If you're wearing headphones, typically at a rate of sound 1 cycle per second. That's the bilateral element. The rate is calibrated to the parameters used in formal EMDR therapy. The layer beneath that and around that alternating signal is the musical texture, often ambient, classical, or nature-based landscapes. EMDR music requires stereo headphones to work. So if you're listening through a single speaker or in mono, you'll lose the bilateral element entirely. So it's better to put your headphones on. The left-right alternation is the mechanism. Without it, it's just music. And EMDR music is available through streaming platforms. You can go on Spotify and listen to it or other dedicated apps, clinical audio tools, etc. It can be used as a standalone self-help tool or in a session adjunct with other formal EMDR therapy techniques. So you can think of it as making it clinically validated neurological mechanism that is accessible to people who may never set foot in a therapist's office. So, what's the global burden? What is the scope of the status? So, before we go deeper, we want to anchor us in the scale of what we're dealing with. 284 million people worldwide live with an anxiety disorder. That's a huge number at the moment. It's more than the entire population of the United States, and it's more than the entire population of the United Kingdom combined. And anxiety disorders are, as a category, the number one most prevalent group of mental health conditions on the planet. The most common, more common than depression, of course, more common than substance abuse disorders as a primary diagnosis. And perhaps the most sobering figure, approximately 50% of people with a clinically significant anxiety disorder do not receive adequate treatment. So half, you ask, or say, why? Well, cost, stigma, geographic inaccessibility, wait times, person preference, distrust of medical systems, you name it. The treatment gap isn't a small problem to be solved at the margins. It's a structural challenge that we have to look at the core of how we provide low cost, low stigma treatment. And how do we help people even in their own homes? So EMDR music doesn't need to replace therapy. It just needs to be part of your larger ecosystem or toolkit that you use to help people. So let's uh, lean forward with our thought and look at some of the theoretical foundations for an adaptive information processing model. So this section we want to look at AIP. It's a theoretical backbone of EMDR therapy. It's an extension of it that makes EMDR music. So Shapiro proposed in 1989 and has refined it extensively since that. This core idea is elegant. The human brain has a built-in information processing system, and when we experience events like just even distressing ones. The system is designed to process, integrate, and store those experiences as ordinary autobiographical memories. The emotional charge diminishes, and we can recall the event without being overwhelmed by it. But when under certain circumstances or conditions, high stress, developmental trauma, or acute threat happens, the processing system gets disrupted, the memory gets stuck, it doesn't integrate properly, it remains stored in an isolated raw form with original sensory, emotional, or physiological content fully um, intact in the memory. So, this is what trauma researchers are calling an unprecedented memory network. When it's triggered by a smell or a sound or situation that resembles the initial event, the full original experience floods back. And that intrusion, that hypervigilance, is what's happening. That's the anxiety and the phobia symptoms that we're looking at treating in therapy with EMDR music. So now, where's EMDR come from? Bilateral stimulation appears to re-engage the brain's natural processing system. It's as if it unlocks the stuff from files, the filing cabinets, and allows it to be properly reintegrated and integrated. And the memory doesn't disappear, but the emotional charge dramatically diminishes. Patients recall the event without being destabilized by it. This is very important. So you can see in my flow diagram here, if you trace it from left to right, there's a traumatic event. There's disruptive processing, isolated raw storage is happening, and then symptoms. So EMDR music intervenes at the processing phase, engaging the system that could not engage its own. So the the next thing that we should be looking at is the neurophysiological mechanisms of how the bilateral auditory stimulation works within the brain. There are three key neurophysiological mechanisms that will help the brain be uh, um, engaged. The first mechanism is the working memory hypothesis. And then this is the most studied explanation of why bilateral stimulation reduces the emotional intensity for distressing moments. So, and it comes from the work of Van den Hout and Engelhard. Both of these people created this model. The idea is that working memory is your brain's active workspace where you hold and process information in the moment, has limited capacity. When bilateral stimulation occurs, occupies the working memory, and tracking the left to right alternation and maintaining orientation, there is less cognitive capacity available to maintain the full vividness of that traumatic memory. So it's rewiring how the brain functions. And the memory is still there, but its clarity, its emotional intensity, its sensory vividness, all that is reduced with the methodology used. The second column, it's called the parasympathetic activation, is the second mechanism in the nervous system activation, and it is your rest and digest system. So we of course know this is to counterpart to the fight or flight response. And when music or calming music happens, like EMDR music, in texture, it activates this nervous system response through multiple pathways, including the vagal tone, and this produces measurable physiological changes. So reduces the heart rate, lowers your cortisol, decreases your muscle tension, respiratory slows. So, research by Thoma and colleagues in 2013 suggested that these effects happen from music specifically. For anxiety disorders, it's significant because the anxiety response is fundamentally a physiological one. It's in the body, not just the mind. And engaging the parasympathetic system directly addresses the somatic substrate of anxiety. So it really is helping at the very core. Then mechanism three we see here is called the amygdala regulation, EMDR, consistently shows reduced amygdala activation in neuroimaging. So the third mechanism, when we're using neuroimaging studies, have reduced hyperactivation following treatment, and it does appear to dampen the amygdala's fear response, potentially through the orientation response, reflective attentional shift that occurs with bilateral sensory input. So over repeated exposures, that reduces the conditioned anxiety reaction associated with specific stimuli. So we're able to rewire the brain basically so that things are changing. So we see different clinical applications of this. We um, see it in PTSD. We see it in GAD and social anxiety, panic disorder, and different phobias. And each has a slightly different mechanistic profile from how EMDR helps it work. For PTSD, it's primarily a trauma memory reprocessing. For GAD, it's a worry cycle disruption by a working memory. For social anxiety, it's reprocessing the socially traumatic memories. And for panic disorder, it's the physiological arousal interruption. So each one has a different way to rewire the response that happens within the person. So let's look at PTSD. PTSD is where the EMDR story began and begins, where the evidence is most robust within our surveys. And over 40 randomized controlled trials were looked at, I just looked at with multiple independent meta-analysis. And each one of these average studies showed that the patient treated with EMDR music does better than 79% of untreated controls. So this is a really good study, and the data is really good here to show that people like the WHO, the VA, the Department of Defense, all can also come to the same conclusion that EMDR music, specifically for PTSD and the auditory component used during active processing phases, allows for a neurological mechanism of the patient and allows them to be rewired and show a dual awareness. So it helps we reduce hyperarousal, interrupting intrusive symptom cycles, and maintains tolerance between appointments so that there's a stability within the patient. The GAD and social anxiety disorder is characterized by pervasive, difficult to control worry that jumps from topic to topic and never is really resolved. The working memory mechanism is particularly relevant, and so worry at the cognitive level requires working memory capacity. This cycle that characterizes GAD depends on the cognitive workspace sustaining itself, so bilateral stimulation by partially occupying working memory can disrupt that cycle, not by resolving the worry, but by interrupting the capacity to sustain itself. So this reduces somatic symptoms, reduces muscle tension, sleep disruption, and gastrointestinal symptoms. And so the EMDR music will show rhythmic bilateral music to help the physiological substrate and help a person with these anxiety problems. Social anxiety disorder requires a slightly different framing, though. Um, it's often anchored in unprocessed memories, embarrassing moments, humiliating experiences, social failures. EMDR shown to be effective in social anxiety and in clinical research and in mechanisms that make theoretical sense. So bilateral stimulation enables reprocessing of those anchoring social memories, reducing their capacity to drive anticipatory anxiety. And there's also a practical element worth noting. EMDR music by headphones and smartphone is discrete, so a person can use that tool whenever they want. People won't know what they're playing on their smartphone or on their headphones, so you can use it on a bus. You can use it in a doctor's waiting room. So there is the portability of self-treatment that's good. Panic disorders. involved reoccurrent unexpected panic attacks, persistent fear of having one, and what clinicians call the fear cycle. One person has had a panic attack, physiological sensations associated with it, racing heart, shortness of breath, dizziness. They become conditioning cues that can trigger further panic. EMDR music addresses this at multiple points. The parasympathetic activation reduces the baseline physiological arousal that makes the panic threshold easier for to be breached. The bilateral element may help process the conditioned fear response. When during and after a panic episode, some external and pattern thoughts become reoriented away from full panic. So this is good. There's also social phobias. Specific phobias are perhaps the clearest application of EMDR music for treatment. A phobia is essentially a conditioned fear response to a specific stimulus anchored in specific learning, so spiders, heights, flying objects. Standard treatment is exposure-based, systematic desensitization of or in vivo exposure. And the evidence base for exposure therapy is specific phobias is strong, but EMDR music doesn't replace that. What it does is augment it. It pairs bilateral stimulation with exposure exercises, and that allows the deprocessing of the person to be desensitization of the person to be escalated and accelerated faster. All of this comes from some pretty good research that we've been looking at to have empirical evidence. We can see that EMDR therapy overall, there's many different studies. I looked at the Van Etten and Taylor ones that in bilateral auditory stimulation specifically, lab studies show that there's a reduction in vividness and emotional intensity of negative imagery. Music therapy for anxiety from the BRAT study shows that general psychological distress decreases, and there is a research gap in EMDR music, but it's research is increasing and needs to become a priority area. So there are gaps and there are limitations. It's not a replacement for formal EMDR therapy. And of course, the risk of stabilization and severe PTSD and complex trauma if caution is not taken. And then there's individual variability within response. So you'll have to alternate auditory input in order for continued success to be there. We should see some future research directions that should happen. We should see how it can evaluate EMDR music in smartphones and apps with telehelp, help maybe giving a treatment over telehelp and telehealth with people. We need to look at some further neuroimaging research, look at biomarkers for therapeutic response and making sure things are happening. I would like to thank you today for tuning in. If you haven't, log into Spotify and listen to some good music and add it to your therapy and your therapeutic techniques. Have a good day.